The Zika virus has been detected in yet another state. The CDC has confirmed that a resident in Arkansas is the most recent traveler infected with this mosquito-borne illness while traveling outside the country. The Zika outbreak in South America is causing widespread concern among women for its link to brain damage in newborns. For more on this, we cross live to Marina Portnaya, who's been following the developments of this ongoing story. Marina, what do we know about this most recent infection in Arkansas?
Well, Lindsay, the Arkansas Department of Health has not yet disclosed whether the infected person is a man or a woman. Officials say the individual was infected while traveling to the Central American Caribbean region, and this was not a local case of infection. What is concerning is the potential for transmission once the person infected with Zika overseas returns to the United States. In a statement, Arkansas's top health official said, quote, "Arkansas has the kind of mosquitoes that carry Zika virus. So mosquitoes here in Arkansas can become infected with the virus if they bite someone who has Zika. For this reason, people traveling to countries with Zika should avoid mosquito bites for 10 days after they return," unquote. Now, some would say even repellent and long-sleeve clothing could not guarantee 100% that someone could avoid a mosquito bite. What is important to underscore is the possibility for transmission. If a healthy Aedes aegypti mosquito bites a traveler who returned to the U.S. with a Zika infection, said mosquito is infected and can pass the virus along to the next person it bites. Now, according to Scientific America, there have been more than 24 Zika cases confirmed in the U.S. since 2007. The CDC says none of the cases were acquired in the United States. Now, since December, people in Florida, Texas, New York, New Jersey, Illinois, Arkansas, and California have tested positive for Zika. Earlier this month in Hawaii, a woman infected with Zika virus during her pregnancy gave birth to a baby born with microcephaly, a condition that causes underdeveloped heads or brain damage in newborns. A woman can be infected during any trimester, and there is no vaccine for the virus. And that is why the CDC has advised pregnant women or women thinking about getting pregnant against traveling to 22 countries or territories in Latin America or the Caribbean with a Zika outbreak. Now, the outbreak in the Americas is believed to have started in Brazil in May of last year. That's when the country reported its first case of Zika. But according to reports, Brazil now has between 500,000 and 1.5 million infections, and 3,500 babies in Brazil have reportedly been born with microcephaly. That's according to the CDC.
Well, I think also what's scary for a lot of people is that if you are at an airport, you get on a plane to go somewhere, but it's just brought in a plane load of passengers from those countries. Who's to say a mosquito infected with it couldn't be on that plane? And health officials are saying Zika is primarily spread by infected mosquitoes. But as you said, now at least 2 cases of human transmission have been documented. What do you know about that?
That's right. On Monday, as we reported yesterday, the World Health Organization confirmed that Zika had been detected in semen, and there was 1 case of possible person-to-person sexual transmission, but further evidence was still needed. Additionally, a doctor from Colorado has come forth claiming he infected his wife with Zika after returning from Senegal in 2008, where he said he contracted the disease. Officials from the CDC say while 2 instances suggest a theoretical risk of sexual transmission, the primary vector is mosquitoes. However, health officials are currently researching all the ways Zika can be transmitted. Now, the Aedes aegypti is the specific mosquito capable of carrying tropical diseases such as Zika, dengue fever, and chikungunya. Now, that specific breed of mosquito has been found in South Florida, parts of Texas, California, Arkansas, and today the University of Notre Dame said researchers discovered a population of the Aedes aegypti in a Capitol Hill neighborhood in Washington, D.C. Now, Lindsay, we need to be very clear. This doesn't mean that all the Aedes aegypti mosquitoes are infected with Zika. They are capable of carrying the virus after biting someone who is already infected. And of course, once the mosquito is infected and then breeds, it could make baby-infected mosquitoes. So obviously, this is a story that's still developing. There's a lot of questions that can't be answered by health officials yet, but they are on top of it. The CDC, the World Health Organization, the governments and throughout the Americas. But it is a cause for concern because of this microcephaly, because of the fact that we're seeing thousands of babies being born with microcephaly, possible brain damage, and the pregnant mothers, there is a link with them being infected with the Zika virus and then giving birth to babies born with microcephaly.
Wow, thank you so much for keeping on top of this story for us. RT correspondent Marina Portnaya, thank you.
Thank you.